the place where women over 50 are empowered to live their best lives. I am your host, Pamela Pitcher. In the segments that we cover, we will be in one of 6 areas: health, wealth, relationships, passion, leisure, and of course, style. This is the space where your wisdom will be embraced.
First of all, Black Infant Health is here to encourage pregnant women who are in the childbirthing process, and they offer resources and they offer education not only to expectant mothers, but also the husbands. And so this is where it becomes important for mature women to understand what BIH is all about. They're all about healthy babies, healthy mothers, healthy fathers, and healthy families for Black people. And I think it's very important for us to rally around Black Infant Health to make sure that our babies come out in a place and space of love. And that's what mature women do.
I love the Black Infant Health Program. They're very motivating. They provide me with a lot of resources. They feed me, and I just love it. I get together with other Black moms, and we just talk about our experiences being pregnant. And yes, I just love the program.
Yes, I'm here to actually introduce myself to the people that's already ahead of me, especially with a doula and helping pregnant women in every areas, in every spectrums of their life, to have comfort and to have birthing good experience.
Have been sex trafficked, pimped, or just pregnant even by the pimps, and it's just really drawn me in to create a village to help these women. And while doing so, I continue my research and reaching out to the community to put together a village, as I mentioned before, for the women that need the particular help.
I'm very excited about Black Infant Health. First of all, I'm very excited about being here. Thank you so much for this opportunity. Black Infant Health is very important to me because the situation in this country as a whole is a challenge for Black people, and particularly our Black mothers of all ages. And this organization provides support and training and mentorship to so many Black mothers who need the additional resources to be able to be successful mothers. We have to understand that our mothers are the ones taking care of our children. They're the ones that make the difference between our children going to school versus prisons, going to college versus the cemeteries. And it's important to me that we make sure we take care of our Black women.
I was well aware of all the challenges that come into motherhood being a Black woman, preeclampsia, weight gain, and that was my fear. Having the insight from Black Infant Health made a difference in my life, truly. My case manager, she held my hand from prenatal all the way to postpartum. BIH is far more valuable than I can ever imagine.
Esther.
Good morning.
Good morning. Thank you so much for allowing us to be in your home today. When I arrived here, I saw your beautiful garden in the front with all the succulent plants, just so beautiful. And now we're here in your garden that is inclusive of vegetables and flowers and green plants and just such a beautiful, serene, loving space.
Thank you. I'm glad you guys were able to come and see my garden. I wish it was a little bit more manicured, but...
But you know what? It's about our lives, right? Our lives
Yes.
are not always manicured.
That's for sure.
Our lives are not always perfect. And when you're talking about a garden like yours, there is work to do every day.
That's right.
And I see
Every
why
day.
you're such a patient person, because I don't have as much patience as you do.
Well, I think it takes a lot of patience. I love gardening. I love my plants, and I love eating from my yard, as well as watching my beautiful flowers bloom.
Oh,
So
that's the key.
it's something that I've been doing pretty much all my life.
Yes.
When I grew up in Louisiana, we had a garden, and we would grow our food. We had a couple of chickens, and that was our eggs. Unlike what today we have, buying these expensive eggs.
That is so beautiful. And that is what we need to recreate, don't you think?
I think so too. It's a pleasure for me to show people how to grow vegetables, how to plant them, and quite a few of my neighbors have enjoyed my collard greens.
On today's segment, I have the privilege of interviewing an incredible woman. This woman's name is Marion White. Marion has been a nurse for many, many, many years, and she has vast experience in the area of Black infant health and African American health overall. So I am really excited to talk to Marion about some of the things that she's experienced in her background working with Black infant health and Black healthcare. So, my guest, Marion White. Hi, Marion.
Hi, Pam. How are you?
I'm fantastic. Thank you for being with us today.
So happy to be here.
Yes, listen, you have got to tell us about your history working with Black infant health and the many organizations that you've had an opportunity to work with.
Okay, so Pam, I started, my interest in Black infant health started in the 1980s. I worked Los Angeles County Department of Public Health at the time. And it was at the height of the crack cocaine epidemic in Los Angeles County. And so I worked along with a pediatrician. Her name was Dr. Dolores Aileen. And we serviced women in the Compton and Long Beach area who were experiencing issues with substance abuse. And so pretty much that's how it all started. Our ladies, our clinic was held at Dollarhide Health Center in the city of Compton on Rosecrans and Oleander. And many of our patients went to Martin Luther King Hospital at the time, and we worked closely with Dr. Exelina Bean. She was a neonatologist at the hospital, and she, serviced our babies. Yeah.
Wow. You know, I remember myself having one of my children was a preemie. And at that time, because of the drug epidemic, it was assumed that I must have been on drugs. And it was like, no, I have such a fright of drugs. And so it was so prevalent back during that time that unfortunately what I noticed was many African American women were automatically kind of thrown into this pocket of if your pregnancy isn't 100% perfect, then you must have been doing something that you should not have been doing. And that's not always the case.
No.
Right?
No, that's not always the case. And, when we talk about pregnant women and Black women in particular, Black women in the U.S., we have one of the highest maternal mortality rates in the world, actually. Women in Africa actually have better birth outcomes than Black women here in the States. And it's attributed to a lot of issues, social stressors. A lot of times when Black women go to the hospital, as you mentioned, people just automatically assume the worst.
Yes.
And, they think that you're, drug seeking and what have you. And so, it's really an issue.
Let's talk about some of those factors that really affect infant mortality. Because in the African American community, as you mentioned, the mortality rates are way higher than non-American Blacks, as well as Hispanics, as well as whites. Our mortality rates are much higher. And I've heard so many different reasons as to why that's apparent and evident and actually the case. Tell me about some of the other factors. You mentioned stress.
Yes, stress. Black women tend to have, issues a lot of times with anxiety, depression.
Anxiety and depression. And so that's a huge, huge thing. And I would venture to guess that at this time, because of our whole experience that all of us have had with COVID, where people really began to have some exceptional, overwhelming types of conditions as a result of having had COVID in the past, right?
Yes. Not only that, there's also, a lot of times there are what we call comorbidity. So you see a lot of hypertension, you see diabetes, you see sometimes BMRs, or basal metabolic rates that are increased in women, and all of these issues can have a serious impact on a woman who is pregnant.
Now listen to this. Those are issues that can affect any woman who's pregnant. Doesn't
Yes.
matter their race.
Yes.
But how does it affect a woman over 50 who may become pregnant? How often does that even happen?
It doesn't. We're starting to see women, I wouldn't say over 50, but more women in their 40s now are getting pregnant. And actually what we're seeing too is a decrease in the teen pregnancy rate. You know, at one point you know, there were a lot of teens that got pregnant, but you know, the numbers have decreased. So now women are electing to you know, have their children at a later stages in their lives. I think a lot of women, in particular black women, are going to school. You know, they're getting educated. They're freezing their eggs and, you know, conceiving at a time when they feel that they have the resources and, you know, to have a family.
Wow, that's wonderful that people are choosing to freeze their eggs and saying that I want to be a mother at some point later down the line.
Right.
And I think we can contribute a lot of that to the fact that those ladies, they saw that their parents had children because they are here, and that they may have had a support system in place that would allow them to be able to continue to have children. And so for them to freeze their eggs and say, okay, later on in life, I'm going to have a child of my own, they know that they're going to have a built-in support system. And that support system could be something like Black Infant Health Project.
Yes, definitely. The Black Infant Health Program has been around for numerous years. You know, after I mentioned earlier my involvement with the Special Perinatal and Rehabilitation Clinic, and, you know, after I left that program, I coordinated the Black Infant Health Program for Los Angeles County. And at the time, I know Long Beach has their own separate health department, and Pasadena had their separate health departments. And so, you know, I'm happy to see that Black Infant Health is still in the community because those services are still really needed, you know, for our women.
Thank you for being here today.
Thank you.
That ends our segment for Black Infant Health. On today's show, you have had an opportunity to see a Black infant health expert, Marion White, who brought to us 30 years of experience in the area of Black infant health mortality. You've also seen today on our show what it's like to have a home garden, how to raise and grow your own food so that your nutrition is improved. Ultimately, you've also had an opportunity to hear what women who are members of the Black Infant Health Initiative have experienced, from the doula to the pregnant woman who's having the healthy child now with their support system. Thank you for joining us. We hope that you've received something that you can take away.